Okay, let's go.
Namaste everyone. Today I am discussing one of the most important topics, deviated nasal septum. Deviated nasal septum, it is important in the final exam at the university of the fourth year MBBS classes. Let's discuss about what is the definition. Definition is the deviation of the nasal septum from the midline, either one side or both sides. You have to remember either right side or left side, causing that cause the partial or complete nasal obstruction. That is the definition. Here you have to think of is the nasal obstruction, deviated nasal, it can give obstruction, it may not give the obstruction. What are the causes? Causes are developmental, that is unequal growth of nasal bone and septal cartilage. Second is traumatic, both trauma, maybe post-nasal injury. There is a compensation due to hypertrophy turbinate or nasal polyp. Heredity, there, yes, familial tendency can occur some cases. What are the type of deviation? This is our most important question in the Viva exam. You have to know this is given most of the book. C type, S type, spore, or maybe thickened crease. This is the common answer. Otherwise, they are classified also. They are different type. Okay, you have to know by Cottle classification: simple, obstructed, impacted. One classification is this one: C type, S type, spore, thickening. Other one is simple, obstructed, impacted. Okay, what are the symptoms here? Nasal. There is a obstruction and there is a headache due to sinusitis. Obstruction is maybe unilateral or bilateral. Headache also there is maybe sinus infection. Sometimes there is a frontal type of headache in any kind of sinus or nose related issue. So one is headache. Epistaxis is some spore. Let's tell spore. Spore can give some vessel erosion and expose vessel in the septum that give bleeding from the nose. Other issue is there may be little decrease in smell. Or the next one is post-nasal drip, need throat clearing. What you see in the examination? Yes, you can see there is a deviated nasal septum. In anterior rhinoscopy, you have to confirm that one. And you can see either deviation on the right side or left side. And there is a little airway in the obstructed side, a deviated side. Otherwise, there is a bigger in the opposite side. You can see hypertrophied inferior turbinate in undeviated side. You can see big turbinate, especially inferior turbinate. This is called compensatory change. Okay. What are the complications? It can cause some recurrent sinusitis, epistaxis. Sometimes there is a polyp chance and medullary infection. Yes, more deviation. I saw many cases of external nose deformity need rhinoplasty also. What kind of treatment you want? The cases I follow as Cuttle classification. Yes, there's simple deviation. You don't need nothing to do. Simple, no symptom, nothing. Simple, obstructed. Yes, you need the nasal decongestant, or you have to treat infection or allergy. Impacted cases. Yes, impacted cases, we need surgery. What are the type of surgery? Two type surgery commonly performed, septoplasty or SMR. Okay, most of the examiner you can ask what are the difference between SMR and septoplasty, but you can summarize or read many, but you didn't come. There are two, three I can give. Yes, SMR, radical removal of the septum, septoplasty, conservative correction. If you know the technique, yeah, that's good. Mucosa, yes, sometime remove, sometime preserve. Most of the time septoplasty we preserve. Yes, radical remove. There is a technique. You have to explain some technical detail there. I'll put in next video. This way, you know, simple question in the deviated nasal septum. I think it will help you. Thank you.